So just quickly about Bonny. She's a member of the National Press Club in Washington, D.C., Tableau user group leader, and a data analytics professional who's working to improve data literacy through education and Tableau skill integration. And she also uses R, Python, and Tableau Prep to explore large data sets and curate empathetic answers to large questions. And she's trying to make the big world seem a bit smaller. So with that introduction, I'll just hand straight over to Bonny, if you want to share your screen and start off.
Is it sharing?
Yes, it is.
Phew, that was like that's the most stress.
It's all good.
Okay, so this is gonna sound really like coincidental, but I basically violated all of Robert's rules of efficiencies because I lost my presentation yesterday afternoon. It just wasn't anywhere. Half of it crashed. So I had to put it together. And to do that, I really couldn't think about all these things that we should think about, but it wasn't built as a service or a deliverable. This is really just about a conversation. And so this is my kind of introductory slide. I'm a bit of a writer, as was mentioned, working for, as a member of the National Press Club. So I do a lot of discovery, a lot of exploratory analytics. And what you see here, I know the talk originally was called Data Talks, Meople, Pumble, and it got that conversation from Lagunista's beer. I was in a Costco and I had to give a presentation and they were saying, what is the name of your presentation? And I happened to look at the tagline on a case of beer and it was Beer Talks, Meople, Pumble. And I was like, well, that'll work. So that's how it all started. So what I'm doing here is I'm within Tableau here. I'm using the story ability to I wanted to make it more like a conversation and like Robert, provide a little context around my life around data, because it's not always just doing the best, building this great biz, that kind of thing. When you work in a consultancy, sometimes you might sit down with a toolbox that's like a mile wide and you get to the table and you say, okay, what's your data question? And everyone just stares at you with like big, empty eyes. They don't even know what you're talking about. So a lot of times we have to build in a little bit of a data literacy, a little bit of a grounding conversation. And from data literacy, we move into fluency, right? Like we know the right thing, we look at it. Now we have to be able to communicate these sorts of things. So this conversation that we're going to have for the next 30 or so minutes, it's going to mirror like a consultation. So this is a bit of what I love about data literacy and fluency. And I always like to share a little bit when I speak or when I work with people. And the Harvard Data Science Review is this spectacular open source data science online journal that is, I can't say enough about it. And the little red things that you see on the slide here, these are just little topic areas, but I thought it really mirrored how we think about data viz as well, because you have learning, you have teaching, we do a lot of mini tutorials, there's overviews, visions, even debates within about, the best way to do something. So I wanted to make sure that you got the opportunity to learn a little bit about HDSR. So it's going to take a few minutes to load up. I'll be looking at questions when we get to the Tableau things that might take a little bit longer. But what I really like about using storytelling is I can mention it and then we can just kind of go right in there. This is the Harvard Data Science Review, their inaugural journal with Zaloming. He's just spectacular. And these articles here are phenomenal. You can dig in as deep as you want into any of them. This one right here, see if it loads. If it loads pretty quickly, they're using modeling to figure out who authored the Lennon-McCartney songs. And they build these data models. And as someone who teaches in Tableau Academic, you know, I like to look for interesting ways to present data. So when you're talking about modeling, I'm just going to scroll real quick before I move on, just to show you that there's math behind it. And, you know, when you click this, you know, when I share the slides with you, you're able to see all these functionalities of how they decided who sang the song and how they built the model to test it. And it's a really nice tool. Like if you have a center of excellence where you work and your responsibility is to, you know, have teaching or learning, it's a very effective and engaging way to do that. And this is a little bit about what I do as a consultancy. It all grew out of this blog that just became the little engine that could, where I look at the intersection of health policy, health economics, clinical medicine, and, you know, share the narratives. You know, I go to DC a lot. I sit in on Brookings Institution conversations and all of these other political organizations and all these other stakeholders around healthcare. And I always feel like there's stuff I want to share with everybody. So it's kind of what I do within here. And I'm just not showing you this for vanity reasons. I wanted to show you, if you scroll down, you know, there's a lot of things about when I'm trying to get to data and I'm trying to analyze it. You know, I learned Python from Columbia School of Engineering. I took an executive education program in applied analytics, and we were like elbow deep in Python from day one. And even now, using Tableau Prep and using Tableau, sometimes I just want to know something and I want to know it fast. And you don't have to be intimidated and think, well, I don't want to learn a coding language. Just these 4 little lines of code right here opens up, you know, a file. All you have to do is put your own file in here, and bam, you know, you're able to look at what the headings are, what kind of data is in the files, and get going rather quickly. So I just wanted to share that with you, because there's all sorts of things there you can just kind of search for. You can search for Python, topics, anything if you're in that industry. Now, where I really pivoted and became, you know, really wanted to focus this conversation, and, you know, the political climate here in the US is a perfect example. A lot of times, you know, we define things first and then we see. Like we decide, like a client will come to you and say, I want to prove that these pharmaceutical companies are the most innovative. Here are the measures I'm going to use. And that's just the end of it. Whereas if we see first and then we define, then we look at all the data, and we might then have an active conversation about how we want to define innovation and how that might be different. So we have to be aware that culture is defining things for us in the space that we're in. Even raw data is not really raw anymore, because we had to make some sort of a intellectual choice between this and that. What metrics were pulled into the quote unquote raw data set? What informed the question that we're asking? We're all influenced from the culture around us. And, you know, when I teach workshops, I really like to use pieces of art, because then people can like relax, the shoulders come down, and they can say, art, you know, am I right? Who gets that? And then the defenses go down and people can actually look. So when I want to talk about bias or being selective in the perception we have and choices we make, I like to start with something like art. Because right now it just looks like, you know, we have little birds up at the top here, and there's fruit and vegetables on the table. But if you look at it, there is some sort of a subtle message here. I mean, if you look below the table, we have all the root vegetables, things that grow in the earth. The peasant sort of foods are being presented, you know, at the bottom of the figure. And then the things that are a little more elite, like the kumquats and the fresher berries and the things that are a little more hard to come by, that wouldn't be in a peasant, you know, cellar, are now displayed higher up. And, you know, think about your data. You know, do you give preferential positioning to certain things that might inform a bias? So these are certain things that I like to demonstrate with art. Another one that's really important, this is an Ellsworth Kelly, and it's called Broken Window in Paris. So that kind of gives it away, but usually in a workshop, I'll ask someone to pretend that I'm on the telephone and tell me what you see. And I've done it a dozen times and no one has ever mentioned that there's a gigantic, triangle out of the picture. The shape of it is a rectangle. And we can kind of tell that it's a window. If we look to the right here, there's a little cord that gives us some information. And what it actually is Ellsworth Kelly taking kind of a self-portrait. These are his legs, actually. And what's interesting about this is I use it to have people become aware of what do you say when something's missing. And this can apply to data as well. If you're looking at a graphic and there's something not there, how do you articulate it? How do you hold the tension of wanting to see more data? And this kind of that, all of that, front matter upstream from data, more or less, kind of integrates with Anscombe's quartet. I think he's from Yale. He was like, I think, the first head of the American Statistical Association. And his quartet is these columns of data that all have the same descriptive statistics. They all have the same mean, the same variance, and the same standard deviation. But as we can see, they don't all contain the same numbers. So why does that matter? Well, it matters because when you do get to the data visualization step and you visualize the data and the descriptive statistics, you can see that we have linearity in some places, or we have spurious data points that are skewing the data. And although the descriptive statistics are the same, as you can tell by looking, that's about it. There's nothing similar. So the anecdotal evidence for context in data visualization is extremely important. And sometimes, if we're not working in enterprise environments where we have like, a common culture or mission, we kind of have to think about these things when we're starting to have conversations. And, those of us who work a lot in population health or with social determinants of health were very excited when the Nobel Prize went to these economists, because what they've done here is extremely unique, is they're using randomized controlled trial methodology as an approach to alleviating poverty and improving health. Now, how do we unpack that, and what does that inform data science or data analytics or visualization? Is the fact that, definitions like poverty, what does that mean? Does it just mean a % of threshold behind a state level decision to say if you're below this, you get funding for things, or this means you're poor, this means you're very poor? They're looking at the actual tapestry of it, the kaleidoscope nature of that data. So, and this kind of leads into some of the examples that I'll be presenting, because I'm looking at it with a population health eye. If I want to look and try to render conversations about poverty or population health, or what do we really mean when we say race? Are we looking at a biologic proxy, a very poor one? Or are we looking at a social construct? Are we looking at a political construct? This informs the kind of data that we pull in. And I'm very string heavy in a lot of the work that I do. So I am going to be going back to Robert Curtis's presentation and taking notes. And just one more share that I wanted to do. This was an art installation by Mimi Anuha. And this is very interesting because they call it the Library of Missing Data Sets. And any of those of you who have to rely on outside external sources of data can probably relate to this. Is, we know that data that's out there, that's openly available, open source, that's things people want you to know. stuff, and there's stuff out there that people don't want you to know, and you have to, like as a member of the press, you do Freedom of Information Acts and you request it, and legally they have to provide it. That's how a lot of that opioid data got unearthed. It was all from Freedom of Information. But what about stuff they don't collect? What do you think they want you to know about that data? That's data they're not even interested in because they're not even collecting it. And so this, when you get the data set, this is really unique because these tabs in her installation, her art installation, these are all data points and information that might be relevant to have that we're not even capturing. So I wanted to share that with you. And now when I start my data, my data journey, there's huge freely available data, lots of big data sets like this at cms.gov. This is the Center for Medicaid and Medicare Services. And so a lot of times if you're in healthcare and you're looking for data, I mean, this is just rife with lots of different data sets that are openly available. Things like, let's see, let's look in here. Yeah. So, look at the breadth of this data. You have year data, you have counties, any county in the US, and then you have measures. You have measures of mortality, readmissions, admission type, how many inpatient days. You could compare that by race or measures of poverty and see how, how are we defining poverty? If you don't have access to healthcare, that's an undue burden and expense. You can also look at primary chronic conditions, disabling conditions. All of these chevrons just break down. And I'm showing you this just to show you, and there is one that I rendered later on in Tableau, just to show you the breadth of data that's out there. And, I would be remiss if I wasn't talking about, well, that data that comes out of CMS, some of it is a little more prepared, and it'll come out and it's fairly clean. You can run it through Tableau Prep and just decide what you want to look at. And like we were just advised to, reduce the data set so it can run more efficiently in Tableau. But a lot of times when you go into that census data, like IPUMS data, or you go into the American Community Survey or anything census related, and you're going to have a lot of codes. Everything is coded. So how are you going to analyze that data? In Tableau Prep, I'm just highlighting these because obviously for the limited time that we have, I can't take you through step by step how I do this. But if you look here, like the region, these were all codes. So really quickly, I just write them in here and get, so that when I bring the data into Tableau, I'm not dealing with all these codes here that I have to look at. And like anything, when you work with these big public data sets, you have to figure out what's the key identifier. So, these are things that you can explore in Tableau Prep quite readily versus trying to find your way through this thing. And this is a bit of some data that I pulled in about, because I'm thinking of poverty and I'm trying to look at things that can, soak up someone's income and make them have less money for things. And there's nothing like healthcare that can make people become impoverished and lose their savings and lose their jobs and their livelihood. And if you look here, what I like about this is the average principal cost per beneficiary of Medicare for an acute myocardial infarction, which is basically a heart attack, right? So what I did here is I created a range here that tells you, so basically, if you're a Medicare beneficiary in the US, you can expect to pay, as much as $3,600, as little as $3,600, and as much as close to $35,000 per beneficiary to treat the same diagnostic condition. And you can scroll through and you can look county by county, counties that are reporting. A lot of counties don't report. And so sometimes this is another one of those things. What do we say when things are missing? Do we want to know if those counties don't report? Do we actually think there's no people there? I mean, there could be less people there, But these are the sorts of questions that we have to bring up if we're going to report on aggregated data, if we're going to look at county level data, if we're going to look at state level data. These are all important questions. So now this next one here is, Medicare readmission rate. Readmission rates, it's a measure that's used a lot within hospital systems for efficiencies. So the data is looking at, a lot of times when we say things about race, we're really not getting granular enough. We don't know why the readmission rate is, in a different range per 100 admissions for, according to race. Is there no one living in these areas of, with darker skin? Are we just not, where's this data? Is it missing or is it just not collected? We don't really know. But what's really interesting about it is you can scroll through here and say the readmission rate is 17 per 100 here. It's, higher here, lower there. I mean, these are really important things to look at when you have to build healthcare into measures of poverty and the costs and what people are doing. And this took this is like 10 or 15 minutes of just bringing data in through Tableau prep and rendering it. Obviously, this isn't pristine and fancy, but it's extremely informative, especially if you're trying to generate a data question. And I talked about IPUMS. What IPUMS does is they take census and survey data from around the world. So you can do global analytics. You can look at, they even have slave data from 1860 that I presented back in February. And, people are kind of, they find it very interesting that this data is freely available. So if you look here, those health surveys, if any of you work with the NHIS or MEPS, which is with the expenditure data, which I have some Tableau renderings I'll share with you that will demonstrate a little bit of that. But I just wanted to hop in here and just show you the huge breadth of data in here for social, economic, and health research, because we can't analyze or visualize data that we don't even know exists, right? So just really fast, so when you come in here, you select samples, and a lot of times you pick a year. You can pick multiple years, but there's a lot of data in here. I usually just go for the big kahuna, pick the most recent data. But what I really wanted to show you is you can do this at a household level, where the house is the granularity, or you can do person level, and each person within the household has an order number, a pernum that identifies them as well. So you can look at children, you can look at parents. What's really interesting here is you can look at migration status. We've always had a migration question on the American Community Survey. You can look at health insurance. The race and ethnicity is amazing, the depth of all the data and the variables that you can collect. But I mean, there's actually in here, there's also healthcare. There's lots of different information in here that you can garner. And, so you start asking questions, you start thinking, well, gosh, I wonder if, if race is a proxy for a social construct, how can we start digging into that data and getting a little more information? And as you may know, if you don't have access to healthcare, you might use the emergency department. That's what ED is here to get your healthcare. And it kind of makes sense if you look at the shape of the curve, right? If the more you make, the less you're going to have to rely on the emergency department. So you can look through here. You can set these things up to answer your questions. I use this from a journalistic perspective. If I have a question I want answered, instead of staring at a spreadsheet, I can look here and I can see the pattern. If you look at this, the patterns for all the races, except for the Alaskan Native because of the low group size, but it's all the same. There's nothing that points to skin color. It's all related to wage income. And this is your welfare income too. It matters, if your income's coming from your welfare checks. You can look to the same sorts of distributions. You can align it by race and also look really quickly to see if the patterns support what we're kind of been told about poverty. Now, I don't see any questions or anything in the chat. This will just take a second to load, because then we can look at health insurance. Like if we have access to health insurance, there's very interesting. In fact, it's taken a little longer. So what I did is I built in a, Julia Child, when she breaks something, she pulls something out of the oven. I'm trying to pull this out here. Come on. Just give it a quick second. I have some that are static that don't need to be rendered right here. So this is kind of like the brownies that I just put in the oven. Now I'm pulling out the tray. This isn't interactive, unfortunately, but when you get the data, you'll be able to do it. It's a very, very big data set. I didn't have time to cull it because, as I said, I had to build these all up this morning to be able to add them to the conversation. But what's really interesting here is the health insurance status. You can do it by region if you don't want to go down to the state level. But, because then the data moves a lot faster. We can look at education and see if maybe that influences health insurance status. The interesting thing, as they get older and you get to Medicare age, everyone's got health insurance. But when you look around here, you can kind of see that there's health insurance here. And then you filter it. When you filter it, you get rid of the ellipses because you're able to get a little more granularity and ask a different question. All right, so this one's going to load. So this is another one. This is more information that what's interesting here is you can also look, there's data, free data in there that divides everything by industry. They have like, this is what your career is. How are people working? How are they making their money? So you can look at this by race. You can look at it by state. You can look at it like, here, I'll run it just really fast. Well, nothing's going to happen really fast. Oh wait, this is the plan B. This isn't the live one. But anyway, what you can do is you can go by state and look for patterns in the data. You can look, these are all different measures, and these are just some sample questions that I put together. But your questions would obviously be different. So I'm trying to get to the plan B. It might render. So basically what I'm looking at here, which we'll load up in a minute, is we're looking at the cost of utilities, which varies by community. It's varying by county. It varies by region, because if you're in a community where the cost of utilities is really high, I'm trying to get this to stop so I can just take you to the still of it. Hold on. Here we go. So here, let's go back to plan B. So this is what it would have looked like if it rendered and we could have interacted with it. But this is really important to be able to look at, well, what do utilities cost? What's contributing to poverty? Is it these high costs of utilities that vary per, depending on where you live? This right here, the not in the labor force, is a pretty big measure. In the census, what that means is you may be out caring for an elderly parent, you may have a child with a disability. All of these things are factored in. You can filter it by race, you can filter it by these regions, and it's really informative and gives more granularity when you want to talk about social constructs of health and you're trying to talk about other sorts of measures that we aren't exactly capturing. And what I think is really interesting about my closeout slide, which is good because we're about done with time, is someone pointed out to me, this operation, the eyes are open. No one seems to notice that they're operating on someone, who's basically wide awake. So the datamonger Bonny, that's my Twitter handle. That's the best way to get a hold of me. And if you have any questions, now's when we would have a few minutes.
Sweet. Thanks for that. I think it was really interesting. Your one of the things that you said in the beginning was that raw data is not raw anymore, that it has an inherent bias. And I think oftentimes when people work with data, sort of the assumption is, well, it's neutral. It's neutral until you find a story or message in it, and that's really not the case. So yeah, I think that's a really important thing to keep in mind.
I know people always get it once I say it and we talk about it, they're like, oh yeah, that is right. Especially when you have expertise working with these gigantic data sets and you see the questions that are asked and you're like, well, that's a weird question. But you bring it into your data and you can kind of see how it plays out. And it's very interesting. It's a question that you wouldn't be able to ask, if you hadn't pulled in that somewhat random variable, right?
Yeah. What do you do to try to minimize the impact of bias that the data has that you work with or that you might have yourself?
Well, a lot of time what I tend to do is I have the ability to hold attention, right? So if the question is articulated and formulated clearly and done well, you're already in a better place. And then when you go to answer the question, you go out and you pull in all the data, and you have to be able, like I did a project once around vaccinations, and there's nothing more polarizing in the United States about that. I had to be willing to look at the data of disease prevention and the good of a vaccination. And then I had to be able to open up the adverse event vaccine registry that we have and look at that data. So, I can't just say go get the shot, it's 100% safe, because I'm now presenting this data where, well, in some kids, and we don't know why, they're dying, they're coming home. It's not a lot, obviously, but, you have to be able to be comfortable having attention around any question that you start collecting data around.
Cool. Thank you. I didn't see any other questions at the moment. So if anybody has a questions, now is the time to ask.
They know they're getting that break.
Cool. It doesn't look like that. Thanks so much, Bonny. So that was our first speaker from the US. Yeah, thanks for dialing in and thanks for being part of that.
Thanks for inviting me. I'll mute my line now.